Hello juniors, so I welcome you all again in the continued series of lower limb, and today we are going to cover an important topic which is the arches of foot. In today's topic we'll be covering its introduction, longitudinal arch, transverse arch, factor responsible for maintenance of arch, function of the arch and its clinical relevance. So if we look from university point of view, the examiner generally asks the longitudinal and transverse arch together, and separately he also asks the factors responsible for maintenance of arch. So in today's module we will be covering all of them together. So these are the arches you all must be familiar of, and you also must be having these arches. So without wasting any further time, let's move ahead. So coming to the introduction, the human foot has three arches that help with balancing, posture, and absorbing shock while running, walking, and jumping. So human foot has three arches. The three arches are, this one is our medial longitudinal arch. This is the medial longitudinal arch. This one is the transverse arch, and right here is the lateral longitudinal arch. Theoretically, human foot has four arches, which is anterior transverse and posterior transverse. But posterior transverse is an incomplete arch. So we mainly study three arches. So before deeply diving into the topic, I wanted to take a quick recap of the bones that forms the foot. So first one is the calcaneus bone, this bone which forms the heel. The talus bone which sits over the calcaneus bone, navicular bone right here, cuboid bone, and three cuneiform bone, the medial, intermediate, and lateral one. These are all metatarsal, and these are all tarsals. And proximal and distal to metatarsal are proximal phalanx. These one are proximal phalanx, and distal phalanx are these one. So starting with the topic, which is the longitudinal arch. Now coming to the medial longitudinal arch. This diagram represents the medial longitudinal arch. It runs across the foot and it lies in the medial side. So medial longitudinal arch is a bigger arch, lies in the medial side of the foot. This arch is more mobile and resilient than lateral arch because the arch constitute many bones which are calcaneus, talus, navicular, and all three cuneiforms and first, second, third metatarsal bones. Since there are more number of bones and more number of joints, therefore responsible for more mobility of the arch. This is the medial view of the foot, and you are able to view the medial longitudinal arch. Here the bones which constitute the arch are calcaneus bone, talus bone, navicular bone, medial, intermediate and lateral cuneiform bone, and first, second, third metatarsals. Here is the animation that will make you understand this more better. This bone is calcaneus bone, talus bone, navicular, all three cuneiform, and first, second, third metatarsal bone. In this diagram, you should be able to appreciate the dark gray colored bones highlighted in this diagram represents the medial longitudinal arch. So the anterior end of medial longitudinal arch is formed by the head of first, second, and third metatarsal. These are the head of first, second, and third metatarsal bones. So the anterior end of this arch is formed by first, second, and third metatarsal. Similarly, posterior end of the arch is formed by medial tubercle of calcaneum bone. This is the calcaneum bone over which sits the talus bone. The medial tubercle of calcaneum bone forms the posterior end. Here is the medial tubercle. This forms the posterior end of the arch. Summit of medial longitudinal arch. Summit is the highest point of the arch. So the highest point of the arch is formed by superior articular surface of the talus. Once again viewing this is the superior articular surface of talus. This is the highest point of the arch. Now coming to the pillars. Pillars are nothing but the bones and the joint which constitute the arch. So the arch is divided into two pillars, the anterior pillar and the posterior pillar. Anterior pillar is long and weak because it is formed by talus, navicular, cuneiform and metatarsals. This whole arch is formed with the help of two pillars. This one is the anterior pillar and second one is the posterior pillar. The anterior pillar, right from here to here, is formed by metatarsal, cuneiform, navicular and talus bone. Since there are more number of bones and more number of joints, therefore this pillar is long but weak pillar. Why? Because there are more number of joints. Unlike the posterior pillar, which is a single bone with no joints, is short but strong pillar. So posterior pillar is short and strong, formed by medial half of calcaneum. Since there are no joints between the bones, therefore this pillar is short and strong. The main joint of the arch is talocalcaneo-navicular joint. So the joint which is formed between the talus, calcaneum and navicular bone. This joint is the main joint of the arch. Now coming to the lateral arch. So right here is the lateral arch. We are viewing the foot from lateral view. So lateral arch is a small arch and it presents on the lateral side. Lateral arch has lesser number of bones, lesser joints and therefore lesser mobility. Unlike the medial longitudinal arch which has greater number of bones, greater number of joints and therefore responsible for more mobility. So right here is the lateral arch. This one is the lateral arch. It is constituted by the calcaneum bone, the fourth and fifth metatarsal. Here is the fourth and fifth metatarsal and here is the cuboid bone. So the bones constitute are calcaneus bone, fourth and fifth metatarsal and cuboid bone. The anterior end of the arch is formed by head of fourth and fifth metatarsal bone. This is the anterior end of the arch. The anterior end of the arch is formed by head of fourth and fifth metatarsal bone. Now here you should be able to appreciate these were the bones which constitute the medial arch and these are the bones which constitute the lateral longitudinal arch. Posterior end of the arch is formed by lateral tubercle of calcaneum. This is the lateral tubercle of calcaneum. This forms the posterior end. So the highest point of the arch is formed by superior surface of calcaneum. So this is the superior surface of calcaneum right here. This forms the summit of the arch. Once again, calcaneum, cuboid and fourth and fifth metatarsal bone are the constitutes of lateral longitudinal arch and the superior surface of calcaneum forms the summit of the lateral longitudinal arch. So the anterior pillar is long and weak, which is similar to the medial longitudinal arch. It is formed by the cuboid bone and fourth and fifth metatarsal. This is our anterior pillar formed by fourth and fifth metatarsal bone and cuboid bone. Since there are joints and number of bones which makes it weaker and long. Posterior pillar is short and strong formed by lateral half of the calcaneum. Since this is a single bone, strong bone, therefore the posterior pillar is short and strong. The main joint of the arch is calcaneo-cuboid joint. This joint, where calcaneum and cuboid bone meets, this is the main joint of the arch. This is the calcaneum bone, this is the cuboid bone. This joint is the main joint of the arch. Now coming to the transverse arch, this is the coronal section of the foot. Here you are able to see first, second, third, fourth and fifth metatarsal. This forms the transverse arch of the foot. The anterior transverse arch is a complete arch because head of first and fifth metatarsal come in contact with the ground. So if this is the ground, so the head of first and fifth metatarsal come in contact with the ground. So bones constitute are all five metatarsal bone. All five metatarsal bone constitute the transverse arch. The posterior transverse arch is an incomplete arch because only the lateral end comes in contact with the ground. If I take the coronal section from further behind, you will only be able to see the calcaneum bone, navicular and cuboid bone and cuneiform bone. In that case, only the lateral end of the arch, which are calcaneum, navicular and cuneiform, only those bones will touch the ground. The medial end of the arch won't touch the ground. So now coming to the factors responsible for maintenance of arch. There are many factors which are really helpful in maintenance of arch. So the factors are shape of the bone, intersegmental tie or ligament or muscles, tie beams and bowstrings and the slings. We will be covering them one by one shortly. So coming to the shape of the bone. So the shape of the bone is responsible for maintaining transverse arch. The transverse arch is formed and maintained due to its unique shape of the bone, that is the wedge shape. Here with the help of this analogy, I will make you explain how shape of the bone is responsible for maintenance of the arch. You can see this the entrance of the igloo. Right here, this one is bit similar to our transverse arch. This is similar to our transverse arch. You can appreciate the shape of the ice cubes. These are wedge shaped. These are wedge shaped, which are necessary for maintaining the arch of the entrance. If these were of any other shape like circle or cuboid, you won't be able to make the arch with any other different shape. Similarly, in maintaining the transverse arch of our foot, the bones are wedge shaped. Bones are not cuboid, not circular, they are wedge shaped. So this kind of shape of the bone allow for maintaining the transverse arch. So shape of the bone is not important for other arches. I hope you are able to appreciate how shape of the bone maintains the arch. Secondly, the intersegmental tie or ligaments or muscle. So basically ligaments and muscles help in maintaining the arches. So the arches are supported by ligaments and uniting the bones. So the important one ligaments and muscle are, here is the spring ligament. Here is the spring ligament. The spring ligament joins the talus bone and the navicular bone. So the spring ligament is an important ligament for maintaining medial longitudinal arch. Likewise, the short and long plantar ligament. This one is the long and this one is the short plantar ligament that help in maintaining lateral longitudinal arch. And there are various other numerous ligaments supporting the transverse arch. So here is the transverse arch and there are various ligaments that support the transverse arch. Now tie beams and bowstrings. As the name suggests, bow strings. This is the bow string. The bowstring keeps the anterior and posterior end of the arch pulled together. So with the help of this bow, I'll make you understand what they work. So the shape of the bone is maintained with the help of this string. The tension in the string maintains the curvature of the bow. If I cut down this string, the bow won't be the bow itself, rather it would become a straight, simple stick. So the bowstring help in maintaining the curve or arch of the bow. Similarly, the bowstrings of our foot, which is in the form of plantar aponeurosis, plantar aponeurosis pulls the anterior and posterior end of the arch together. So this is our plantar aponeurosis. It pulls the anterior end and posterior end of arch together, help in maintaining the curvature of the arch. If this plantar aponeurosis was damaged or cut, the anterior end would shift forward, the posterior end would shift posterior. That could result in the flattening of the arch. So the big picture is the bowstrings or tie beams, they keep the anterior and posterior end of the arch pulled together. Now coming to the slings. Slings pull the summit of the arch upward. With the help of this analogy again, this is the summit. This is the Golden Gate Bridge. The summit is the highest point and it is pulled upward by, here is the cables. So these cables are called slings. So the highest point is pulled upward with the help of slings. The summit of the MLA medial longitudinal arch is pulled upward by tendon of tibialis posterior, flexor hallucis longus and flexor digitorum longus. So this is the summit of medial longitudinal arch. This summit is pulled upward with the help of tendon of tibialis posterior, flexor digitorum longus and flexor hallucis longus. You can appreciate how these tendons pull the summit upwards. Similarly, the summit of lateral longitudinal arch is pulled upward by peroneus longus and peroneus brevis muscle. So this is the summit of the lateral longitudinal arch. It is pulled upward by tendon of peroneus brevis muscle and tendon of peroneus longus muscle. I hope now you are able to appreciate what are the factors that maintains the arch: shape of bone, intersegmental tie, ligament or muscle, tie beams and slings. Coming to the function of the arch, as I've already told you, arch help with balance, posture, shock absorbing, running and walking. Lastly, coming to the clinical relevance, absence or collapse of the arch lead to the flat foot. Flat foot is also known as pes planus, which may be congenital or acquired. If a baby is born with flat foot, it is congenital, or the malhabits which lead to the formation of flat foot comes in acquired. So the flat foot leads to the clumsy gait, meaning the walking style of the person will be a bit odd, bit changed, loss of shock absorbing function or capacity of the foot, and once foot become flat, it lead to compression of nerves and vessels of the soul. So we are done with the introduction, longitudinal arch, transverse arch, factors responsible for maintenance of arch, function of the arch and its clinical relevance. If you found this video helpful, do like it, do share it with your friends. I'll soon upload another video on lower limb. By the time, bye bye, thank you.